Hello everyone. It's my pleasure to welcome you to the second webinar organized by Publicum IM that focuses on crisis communication during the COVID-19 pandemic in the Balkan region. First, let me introduce myself. My name is Bojan Stojkovski, a freelance journalist covering tech, science, and foreign policy in the Balkans. And during these 6 months, and I would say even before that, I have reported on various aspects of how the pandemic has affected the Balkan region, and especially when it comes to the emerging technologies and the various tech-driven solutions that institutions and governments throughout the region have implemented in the battle against the coronavirus. Today we will try to find some answers, to raise some points and open up discussions about what we have witnessed during the 6 months of this pandemic, especially when it comes to crisis communications between institutions and reporters. So with me here today are Catalina, Aghinitei, Director of the EuroDEMOS International Programs Department from Romania, and Bojan Kordalov, Skopje-based public affairs and new media specialist. So I would like to start today's discussion with the premise that aside from the pandemic, we're also facing a certain kind of infodemic, which basically means that we are having an excessive amount of information regarding the situation with the virus. And at the same time, this makes us doubtful and suspicious to a certain point of all of the approaches and possible solution when it comes to handling this COVID crisis. Regarding the situation in Macedonia, so I would say that from what I have witnessed so far, we are having kind of a mixed, or some would even say it's a disputed success when it comes to dealing with this crisis. So far we have witnessed quarantines, curfews, and many other measures that led us to the situation that we are now in. However, when it comes to the crisis communication part, I'd also say that this is an aspect that has left many of us confused, since we have gone from seeing institution officials having several press conferences a day, which were broadcasted mostly through the traditional media, to the point where now we are getting most of the information through social media. So faced with a situation like this one, we have to pose a question. Where are we now and how did we get to this point? So first, I would be happy to hear more about the situation in another country, which in this case it's in Romania. So we could make a comparison in how different countries in the region are dealing with crisis communication during the pandemic. So now I give the floor to Ms. Catalina Aghinitei, who can also tell us more about the organization that she is representing. Thanks.
Hello, dear colleagues, and hello to everybody that is watching us. Firstly, I would like to thanks for the invitation to the organizers, Publicum, and for the moderation. We are happy to work together because EuroDEMOS Association, it's an international organization that has 30 years of activity. It's a human rights defense association and the oldest opinion forming leaders association from the level of the Council of Europe. And as a matter of fact, as I was speaking also with my colleagues before starting this webinar, EuroDEMOS Association it's already planning for the next period to come more in the Balkans and to develop much more the activity. But of course, we are waiting for the moment when the situation will make this possible. Also, as association, I can tell you that we are functioning since 89, and we are considered to be success story at European level. And all the time, in all the fields that we approach, we did the best to be a model for the others, to bring contribution in our community. This is how we do also in our days. And coming back to the situation that is happening these days related to pandemic. Of course, I have a lot of collaborators in many countries, inclusively in Macedonia. And I can tell that similar situations are everywhere. We cannot tell that only in Romania or in Italy or in North Macedonia, it's a situation that is happening only there and that it's unique. What is happening in generally, we saw how it's happening the process. Sometimes the opinion currency moved from west to east or differently. But we saw every time, because I was speaking with a friend from Bulgaria, and at the moment in Bulgaria, everybody was buying everything from the shops. After 1 month, this happened in Romania. And I checked with every opinion currency that what's happening everywhere. So we can say that we have this in common. And also during this pandemic situation, I can tell that especially we are very connected at the European level, also as organization, but also as country being member of the European Union. And it happened to be a problem, but it happened to be an opportunity for the European Union to promote more, to be more united and to work together. This is how it is also the strategy now. And in a way, because before this pandemic crisis, we were speaking also at European level, but also at national level. It's economic crisis, it's social crisis, it's educational crisis, it's climate change crisis. In March, when this situation appeared, in Romania appeared in March more strongly, no more other crises we are speaking about, everything was centralized in one. So in a way, the people forgot about the other crises that are still in development. But they were started to search for common strategies that happen. And if we speak about the crisis of communication, I would say about the fact that we can see this from different perspectives. It's like we can speak about the communication at international level. Because in China, as I was noting that on 27 January in China was total quarantine. And after came very fast in Europe. Why? Because first confirmed a person with this virus was on 31 January when came to Italy. And in Romania, the first case was on 26 February. This is how it started. But at that moment, we can say that our authorities said that it's a passing. They will solve it and they will do it in a way. But didn't pass even 1 month, because on 16 March, the president of Romania declared state of emergency. And of course, in that time, they were closed the flights from Italy to Romania. So there was not so much communication between the states, because if we have cooperation as Europe with China, we could learn from them and hear them what is happening. Being a virus that it's very easy to be spread was impossible, because everybody is traveling, because we have commerce, because there is so much freedom to do all of this. So if also at this level would be communication, maybe some things were stopping. After we can come back at the level of the national level and with the level of the local authorities. The same. In many countries happened a lot of conflicts because sometimes it happened that the virus to reach just a certain area, and other areas, like it started in Italy. Big country, and a part of Italy was totally without virus. And there were a lot of manifestations within the country when it was closed, because they said we don't have it in our region. Which, the same, we speak about crisis of communication because it is in your country, doesn't matter, because after anyway the virus reached also the other regions. And after, and the most important one on which I'm sure we want to focus in, we speak about the communication from authorities to the citizens. As you know, before this COVID, I know for sure that in all the countries, the citizens don't have trust in the authorities. It's true? I think it's true. Also in your country and in our country, not enough trust. Not it's like they don't do nothing from what is saying the authorities, but they don't have enough trust. Because when the authorities start to make publicly what is happening, the people said, oh, might not be true, maybe it will pass, maybe it's not a thing that will cause so many problems. This was at the beginning. But I can tell you in Romania that on 16 March, when the authorities showed the gravity of the situation and presented publicly, also with opinion from the specialists, from the medical, from the hospitals, because the citizens believe the specialists, not only the authorities, because they understand who's the one that can really have an opinion on how it is the reality. On 16 March, when it was this declared, and I told you, a lot of press conferences and all the media promoted and not promoted, inform the citizens about the real consequences that can appear after this virus will be spread. I can tell you, in my city, but also in many cities from Romania, the citizens respected the authorities. Iași, EuroDEMOS Association has in Romania the central office in Iași. It's the second biggest city from Romania, and it's at the border with the Republic of Moldova. It's a cultural city, and it is a city of intellectuals. And the people, when they heard it's better to do it like this, majority of them, they stayed without any problem 2 months in the house. And this, it was seen, because the number of the cases decreased, but after, unfortunately, the summer has come. And also the people cannot stay forever in the houses. And since there were not so many restrictions, soon also in Romania we'll have local elections. So also a lot of activity from this point of view, it will happen. And now, of course, we have many cases because everybody took holidays, go to the seaside or to the mountains, because we have everything in our country. And we are happy that a lot of people this year choose to spend holidays in Romania and not in other countries, because it's they said it's the best way, and not being facing the fact that they could not travel in the last moment. But yes, even if the cases has reached, we can say that in our country, in this moment, the situation, it is in a way under control, because the authorities do the best. I know also in Romania, but also the international level, even if I have a lot of statistics with what is happening, for sure, not the real number of the persons which are infected, it's no, because it's impossible. We should understand also the authorities and the medical system. It's impossible for them to test everyone. What we can do, yes, is the same, to respect the restrictions that appear, because we see that if we put in the balance, a lot of people and everybody that respected what it was promoted as being healthy and how to act during this time didn't get infected. This is a good part. And yes, also I wanted to tell the people suffered a lot and were affected about this situation. But as you know, also a lot of jokes were made. Because if before, in all the countries, most of the jokes were on the base of the politicians, now all the jokes go on related to COVID. So people, in a way, understood the situation and try to keep the moral up. And I really saw very, very good jokes. Even one of them, you know, when I put in the calendar all the years what I did, some of them, they say 2020 doesn't exist. No, I think differently. I think 2020 exists, and 2020 it's history for us. Because we'll remember about this year, we remember about what it happened, and if previous year, in 2019, all the opinion currency were saying, don't stay so much online, go outside, work and everything, be active, but in a social and interacting with people, and 2020, it's differently, as we can see, stay home, make things online, because this is how you protect your family and your community, and of course, yourself. So yes, in Romania in this moment the number of cases is rising, and all the perspectives shows that it will rise until the end of August, because everybody is moving, going to many places. But after that, they say it will become more lower, because the people will come back to the activity, will try to respect the rule, and even I don't know how it is the system of education now in North Macedonia, but in Romania the high schools and the university are planning to start activity, to respect the distance and all the rules, but they plan to start the activities face-to-face, not from online. In this moment, they didn't say it that it will happen. They say they still wait 1 week or something like this until to declare it for sure, but the plan, it is like this.
I see. So, yes, basically, Catalina, you raised certain points that are very similar to what we are facing here in Macedonia. Especially when you said when it comes to the low trust in authorities. I think that this has been an issue throughout the whole pandemic. So now here I would like to connect this part with the infodemic and ask Bojan, what is your opinion, Bojan, about now? Is the infodemic maybe the more dangerous aspect that we are facing of the pandemic now?
Thank you, Bojan, for the introduction. Thank you, Catalina, and first of all, Public Comin for organizing this event. We have to admit, first of all, that this pandemic was new for everyone, and we are all confused. All of us, including the institutions, made the mistakes, made some wrong steps, and that's normal because when something's new, we have to adapt it, we have to start moving and living with it. But I think that 6 months from the start of the pandemic is enough time to discuss this and try to find some conclusions how we can change things, because it's obvious that we don't, one thing is obvious and for sure, and that is that we don't know how long this will last. So we have to change, we have to have lessons learned, and we have to make things better. So when we talk about your question about infodemics and pandemics, it's definitely those are the two most important aspects in this crisis. First thing is, and the most important is the pandemic or the health aspect of this health crisis, and the second is communication, or the way that we communicate with the citizens, and the way that public institutions communicate this pandemic with the citizens in the country and overall in the world. So also Catalina mentioned, and you also, Bojan, about the trust in the authorities. And actually that's the main target of the fake news, because the creators of the fake news have the public institution as their target. The aim of the creation and spreading of the fake news is to target the institutions and the trust that the citizens have in the public institutions. So it's really huge problem, and we have to find ways to deal with it, which means that our first lessons learned should be that we should focus on the tackling fake news, and the second to put the digitalization in the focus, especially in the sphere of the public service and in the sphere of all the aspects the citizens needs to go through this pandemic. Then we should also discuss about the possibility or the need to change the way of communication that the public institutions have. That means they should communicate faster.
I agree. I cannot hear Bojan.
Yes, I cannot hear him also. I think it stopped from the internet. It's happening and we all can understand.
Yes.
It's not really up to us. But yes, I think at the moment he will for sure come back. Until he's coming back also, Bojan. I can. Okay, he's coming. We didn't hear you. Yes.
Now I think it's okay now.
Yes.
Is it okay? Okay.
Yes.
Yes.
I don't see you moving, but okay. What I wanted to say is that all the public institutions should use all the channels to communicate with the audience, which means traditional media, social media, but some other aspects that we thought should be left in the past, like some terrain activities, some activities from the field, because not only in our country, but everywhere in the world, we could see actually some percentage of the population that doesn't believe in the official information, doesn't believe that COVID-19 exists, or it does not believe that they should respect the measures and everything which is in interest in our health, which makes really huge problem. And sometimes to reach these people, to reach this population, means not just using the traditional media and social media, but also some other traditional aspects of communicating and field activities. That's the first thing. Also, what I always want to stress or point out is that we have to have restrictive measures. That's normal because institutions and governments should care about the public and individual health. But at the same time, all the institutions must stress that they are doing their best to preserve the democracy, to improve the democracy and democratic measures, because pandemic is also some kind of test about xenophobia, about hate speech, about discrimination, and we should not let that happen. And it's really important how we communicate with the citizens, how we communicate to each other, and especially how the authorities, the institutions communicate with the citizens during this pandemic, if we want to preserve democracy, and if we want to stop these forms of discrimination, hate speech, and xenophobia. Then I'm going to the next fourth point, which means that this is definitely crisis communication from the very beginning, and it needs all the public sectors, peer public sectors in the institutions, to have or to gain competencies in crisis communication, because it's really important. If we want to tackle disinformation, we want to have teams that will be able to recognize disinformation, to act, and to help citizens not to spread this kind of fake news or disinformation. I would also like to say that maybe this is some kind of theoretical, but I think it's important. And also the European Union in the joint communication plan tackling COVID-19 disinformation finally mentioned it. There are three types of fake news actually: disinformation, misinformation, and malinformation. It is really important to recognize all these three types, because we usually combine or we make synonym of fake news only with disinformation, which means that is fake information tending to harm some institution, individual, or some group. But also misinformation, malinformation are important, because when we talk about misinformation, we are talking about fake news, fake information, but sometimes people do not tend to spread that information because they want to harm someone, but because they want to protect their lives, their close relatives, family, friends, etc., etc. And also talking about malinformation, which is often completely correct or part of some official information, which is abused with spreading just to make some harm to institution or individual, etc., etc. So that is very important about the peer teams if they want to have lessons learned, and if they want to help tackling this infodemia, and if they want to make some changes. Because at the end of the day, we have to know that the time is changed, and that's not just some good thought or some good sentence, which sounds good, but it's reality. The reason why we are now discussing this through this platform and not in some conference room in some hotel, or maybe Bucharest or Brussels or Skopje, etc., etc., is the first proof that time has changed. And if the time has changed under the pressure of COVID-19, that means that all the public sectors, especially peer sectors, communicators, should change. And they don't have the luxury anymore to say that they were unprepared. Okay, at the beginning, all of us were unprepared. 6 months after. We have to take the best from everyone. We have to take the best examples and lessons learned and implement it, because this may last in months, maybe in years, we don't know. But we have to be prepared, and we have to act at our best, especially public institutions. And I will finish with the education. Catalina asked how is it in our country. Actually, we're still waiting for the final decision. The announcement last week was that all the pupils until 3rd grade will go in the schools, and all others will have online learning, but we'll see what will happen in the end. Probably it will be the case, but however, it's still a huge debate how all this should continue. So I will stop here. Thank you very much.
Okay, thank you, Ben. So there was I can hear something in the background.
So
I'm not sure what it is. Yeah. So now it's okay, I guess. So, well, basically from the points that Bojan mentioned, I would like to single out the one about how these messages are communicated to the public. So one example I would use here is about the introduction of the contact tracing apps. So if you remember, so like back in April, Macedonia became the first country in the Balkans to introduce such an app. However, now, like 4 months later, we learned that this app basically didn't detect any cases, or maybe it just had a little impact on the fight against the COVID. So basically, in my opinion, this is partially due to the lack of campaigns from the authorities on how the public should use the app, of the benefits that this app gives. And this issue, I think that mostly is down to how it was communicated to the public. So would you say that this is also a certain challenge that we are faced with, and that also other governments in the region are dealing with such difficulties? Because the contact tracing app was really seen as a tool that could help the fight against the pandemic. So, Catalina, can we hear your opinion?
Yes. Now I open, and yes, I would like also to come back a little what the other colleague pointed about, Bojan Kordalov. I wanted to come back regarding how he said it is this fact with the fake news, because the opinion currency in all the countries, now we can split them in three. There are people, as you also said, Bojan, there are people which they said doesn't exist COVID, because there are some economic interests in the middle which they want to promote this, because they want the people coming back to work. So because media can also sometimes have some TV shows that are sponsored by other persons, so also with the social media it's easy to transmit this. There are people, and now there are less, but at the beginning when it started, the pandemic situation, there are people which they thought, okay, it exists, but I will not have it. And a lot of public personalities, which they were very free and didn't respect all the rules. They saw the virus doesn't respect who you are, your social position, your economic position, because it's coming through the air. You cannot stop it because you cannot stop breathing. And there are also people which really understood how can affect this pandemic, and the fact that especially it has very grave effects on the persons which have also other disease, and they really respect the rules. They really use the mask, they really use the distance, and they feel safe and protected in this way. and they also take care of the other aspects of the health, because it's not a good time to go to the hospital, taking into account that all of them are full. And for sure, yes, I can tell from my family, I have persons which are doctors working in the medical system. And yes, this virus exists, it's developing, and a lot of effects are happening. But yes, from this point of view, we can say that a lot of field and a lot of persons were believing also in other types of opinion currency. And also, I wanted to underline the fact that 2 months in Romania, in those 2 months, when the people understood the gravity of the situation, they respected and they trust in the authorities. And from this point of view, we can say it is a game, because also the public authorities in that time in Romania, it had to be voted the government, because the government had to take decision and so on. And also the parties that were in power and also the parties that were in opposition, the same. They really understood the situation, they became united, they voted one government and they voted all the measures, because in very short time was supposed to take measures with the hospital, to supplement the funds, to supplement the test and everything. So from this point of view, it doesn't sound very good maybe in this pandemic time, but there were some gaining that happening on the short time, because the people really understood that what I was saying at the beginning, through unity we can do something. And also, yes, in Romania at the beginning when the situation started, they were the public authorities, they were organizing, and especially from the government, they were organizing a lot of press conference, and all the media was there. It's like at the beginning, you are seeing, if you are opening any TV channel, you are seeing the same news, the news transmitted from the authorities. But after 2 months, the things were changing. Some of them started to promote also other news, not only those from the authorities, and this bring up the fact the situation became more worse and more cases to appear. But yes, we should see everything that is happening. When a danger from outside is coming, you see the people can become more united and more trust in their countries, in their electees, and to trust that they will take the right measures. And yes, the same, I agree with one that some drastically and strictly measures had to be taken because we saw the results. But yes, it can take time until the situation will be solved and until the real measures to really stop this pandemic it will. So I don't know if the solution is to have these strictly measures until the end. Has to be also alternative to respect some rules, but to continue the life, because everybody has to live. And for some of them, like for example, before the situation with COVID-19, in Iași, the rate of unemployment was 0, because we are a big city. If we are speaking, we can speak in Iași about underemployment. You know what it means? Underemployment means a lot of people, they have a lot of qualifications, are very good prepared, but they work in lower position than their educational and their specialization. But was 0 unemployment. Now, after it happened this, a lot of, because we have a lot of terraces and some of, let's say, institutions and businesses which had to stop during this time, a lot of people get unemployed, especially from the young generation. So we can see that things really happened and had impact. So the authorities, yes, we think, and the authorities, this is what they do now. They work with the specialists and they will continue to do this and to promote the adequate measures that the citizens to respect in order to continue. I have to continue to go to work, to go to school, but respecting the rules as the cases to be less. And also a lot of cases are, the number of the cases of the persons which were healed, it's big, which is very good. Means in Romania appeared many types of solutions, because we have many big cities which have medicine universities and a lot of good doctors which they found. But as we know, until to be taken into consideration a final solution for this, a lot of tests have to be made. So it's not declared one of them as being the best. But in Iași we have really a lot of people which were healed and got out, and now they are back to the normal life. And yes, as I was saying at the beginning, if at the beginning 2 months the majority of the news were transmitted through the television channels, which I want to point one more thing, the fact that people during pandemic, when they had to stay at home 2 months, they started watching TV. Before they didn't watch because they didn't trust the media and because they were saying only bad news are there. But after the media started to give this information from the authorities, really it raised a lot the audience of all the channels of television during those 2 months. But now, yes, it is the same also in Romania. It started to come back, and a lot of people to use the social media more than the television. And in social media, everyone can promote a lot of things which are not official because there are not so many risks and because there are not so many consequences. And this is how, yes, we lead to people not knowing the reality, not understanding, and taking some opinion currency that are in trend and that are promoted and not respecting the rules. Because I told you, when the population understood the risk, respect it. It's for our health, okay, let's do it. But now some said, okay, it's not really that dangerous. If it's not that dangerous, why to continue to respect and do not come back to the real life? So yes, online, it's now in the power of as way as population are accessing the source of information, misinformation, disinformation, how we would like to call them.
So, having this in mind, Bojan, as a new media specialist, what is your take on the debate of traditional versus new media as in the role in the pandemic?
Actually, we have very similar situation here about a lot of news conferences where the minister, the health authorities were reporting about the cases and situation with COVID-19 all the time. And yes, at the very beginning, it was really the only thing in the news. The number of cases, what should be undertaken, how should we be protected, what are the new measures, restrictions, etc., etc. And yes, 2-3 months after that, it was like spreading to different channels. It's the same here, but still, there is one thing which is very important to be underlined. There are two types of institutions in this crisis. The first is actually are the health authorities, and the second are the other authorities. I used to call them civilian authorities. Health authorities are doing their best, are doing everything that they can to face and to solve this problem, because it's health problem, it's virus, COVID-19. They're trying to fight with it, to find vaccine, to propose the best measures, sometimes really restrictive, but to protect the health of the individuals and the collective health, and that's fine. But very often, other institutions, civilian institutions, are not following the steps of the health institution. What does it mean? It means that whenever health authorities propose some restrictive measures, other institutions should promote and propose alternative. Let's be plastic. Let's talk normally. Health authorities say it's not responsible for the concert halls, theaters, cinemas to be open because the virus is easily spreading when we're going there, and say we cannot let at the first time these art institutions to be open. Okay, fine, but then the Ministry of Culture, like civilian institution, should propose measures. What are we doing then? Are we going to just wait for months, for years, without culture, without music, without theater? Someone will say, yes, but you know, health is more important. Yes, the health is the most important thing, but still, people have needs. It's okay to say, I don't know, 2 hours, 10 hours, 1 week, we will have to wait. But if you don't know how long you will have to wait to open the theaters, you should have an alternative. And the alternative measures of the restrictive measures should come from the Ministry of Culture in this direction. Second, education. In March, it was decided by the health authorities that the education should stop in the schools and all the pupils and teaching and teachers, professors should go and work from home. At the same time, the civilian authority, which means Ministry of Education and Science, should present their alternative measures, how the education will immediately continue. That's the second example. And the third, also in March, our ministry or health authorities, health institutions proposed that all the gyms should be closed because it's a problem if we go to the gyms because the virus could be easily spread. And that's scientific restrictive measure. It's not that someone was sitting in the ministry or in the health cabinet and thinking how to stop it. That's scientific measure. But the civilian institution should find some other solution. Online gym courses, online exercises that should be given free, etc., etc. Instead of that, we here, but as I can see everywhere in the region, anywhere wider, was all the time talking about the pure economy, how to give to the companies money to live. Actually, the question is how can we help? How can we assist? How can we help all the private sector to find some sustainable solutions in this crisis? Because I can give you a lot of examples of private schools, private gyms, private theaters, public, how to say, pop stars, which are trying to make their concerts and trying to sell tickets via internet, etc., etc. And that's how they manage to live during these 6 months. So actually, I think that that's the biggest challenge and the biggest problem. And the institutions should really work closely with the health institutions, not just in awaiting them to give them the protocols or the way how they should function. That's fine, that's important. But second, they should be innovative. They should propose actions. They should propose together with their stakeholders in the area, in their field, to propose what should be undertaken. Because if I now say that maybe all the concerts will be online, it's strange and unacceptable, even for me. I would like, for example, I have a plan, I have ticket for Brussels in November for Anna Netrebko solistic concert, operatic diva, which I want to go. And for me, it's unacceptable to imagine that I would not be able to attend that concert. But it might be true. Maybe the future of the concerts will be online. No. But however, we should work on all scenarios, because the worst thing is to convince the citizens, the people, that they should not expect anything, that they should just wait, sit, and wait when this is over. That's okay, but it's not acceptable. It's not possible to happen, because every individual has needs, has plans, would like to live as much as is possible. So if we somehow manage this, if we somehow make the communication with these two kinds of institutions more close and more coordinated, first on national, then on regional, and on the world level, I think that the consequences will be not so huge, and I think that we'll be able to come out from this situation more and more quickly. During this question, I would just like to emphasize that journalists or the media workers, photographers, videographers, etc., are really heroes in all this pandemic, not just in our country, everywhere, because they were really facing the pandemic, almost like the doctors, because almost all of us were staying at home, or were having some reduced shifts, or we were just going to our workplace and back. But journalists had to cover everything. We were talking about press or news conferences of the ministers of health in Romania, in our country, and everywhere. Who covered that news conference? The media. So I would like to stress once again that all the media workers were and will be real heroes, and the government should understand, all the government, not Macedonia, but each government should understand that they should be real partners, because the media are the responsible ones, because we are managing to tackle disinformation. Because in this pandemic, in this infodemia, we understood that only with professional journalists, only with professional standards, and only with building professional relations between government or public institutions and media, we can win this fight in the infodemic part. So I would strongly recommend here, everywhere, to focus on this, to really understand that we should pay more attention on the media, and we should put more space, because it's not just when the public authorities have to announce something and to say you must publish this because it's public interest. But whenever some journalists ask questions, it's the same and even bigger public interest than when the public institutions want to announce. Because journalists are not asking questions because they would like to take the questions at home. They are asking questions or asking clarifications because it's real public interest to know the truth or to know the different aspects of the story. So I would also stop here, and thank you once again for this opportunity.
So thanks, and as Bojan said, I would agree that yes, the media is definitely here to kind of bridge this gap between the excessive amount of information that we're all getting, and to simply put them through a filter and let the audience the most important part for their health. But also I would here like to raise another question, and this is basically based on the approach that governments and countries are having. So in the Balkans, we are having some countries that are NATO members, some are EU members, some or more of the countries are actually both NATO and EU members. And how much do you think that this plays a role in tackling the pandemic? So Catalina, like coming from a country that is both EU and NATO,
Yes.
what do you think? Mm-hmm.
Yes, it is a very important aspect, because in the last period of time, the population from many European countries started to have more trust in the European Union. And it really helped, because a lot of opinion currency were directly transmitted from the European Union, and a lot of measures to sustain each other when one country was in a bad situation and one in a better one, and had the possibility to help each other and to show again that together it is possible that we can be unified. And the news in generally, and all the information that are transmitted from the European level in my country are appreciated, because it's thought that we are so many countries, and we are the European Union is the structure that, a unique structure that managed to have so many countries inside and to work democratically. And this counts. And also especially because it were a lot of investments made, and because also the young generation has a lot of benefits. And when we invest, European Union invests a lot in the young generation, because from the young generation can be transmitted also to the others. And this brought a lot of positive in our country. And because you are speaking about the importance, both of you, you are speaking about the importance to bring together actors from the community, we can say also about civil society, because the EuroDEMOS Association, as I told you, it's a non-governmental association, and it's the first from Romania, and from EuroDEMOS Association it was written the history of the civil society. And it is important because we also promote some opinion currency which will reach the population in a different way, because they understood we are the civil society and we are not up on the government or other types of institution. If we really approach an information, we will bring it in an independent way. And because we already have a name and a lot of activities, also local and national level, we can say that this counts. And for this, also starting with the autumn, we prepare a special program to promote what already authorities are promoting, but we want to promote in an attractive way and more understandable, because you know how the public announcements are on the television. The people don't want to hear anymore. So we thought about, and we already made some tests within online meetings that we had until now with our staff and with our volunteers. And from the autumn, yes, we prepare from this point of view, because working together, as you said, we can really do something in the community, starting from European, national, but also local level, and bring everything in the attention of the citizen. The citizen can really understand, but we have to transmit it in the proper way to reach him, and to think about that it's also in the period of crisis can be more stressed. So that's why, as I was saying, in a way, the fact that appear so many jokes related to COVID made the population to be more relaxed. But on the other aspect, do not overpass some measures that are proposed, because we go into the other direction. And yes, it is very important, an aspect that is promoted also from the European level and respected in all the European countries, the fact that we should safeguarding the freedom of opinion and media diversity. This is very essential in our community, to have many sources of information and to have the possibility to speak free. If you find out something that could be on the public interest, to make it, but to have also proofs for that, not to be just us to spread some information, disinformation, or other aspects. So this is also, yes, one of the points that count at the European level to sustain. As you saw, there were a lot of conferences also at the European level, and to sustain the fact that media can really transmit in an independent way and can come back to its role, what is happening, and what measures are taken.
Mm-hmm. So, in the case of Macedonia, the country officially became a NATO member during this pandemic. So, Bojan, what is your thought about this? How did this affect? Because NATO did give some, made some funds available to fight the disinformation.
Actually, it's not just funds, it's masks, another equipment, and we could see that during these 5 months. It's something that we could see with our eyes, and we discussed in the media and everywhere. So it definitely benefit from the membership. But I would like to also stress that during this pandemic or this COVID crisis, the solidarity became again one of the main aspects of the Euro-Atlantic integration. Actually, solidarity is one of the main aspects of becoming member state of EU or NATO, because integration is always the key. If we want this to finish faster, if we want to achieve better results, we have to be working together. And we should turn towards regional cooperation, regional approach of all the problems, including communication, because nowadays we can see really huge problems of not so clear communication between our countries, even neighboring countries. We have decisions of changing plans for travel in hours, in days, it would all be different if all the regions has actually regional approach, common approach. When the leaders and when the governments discuss and find solutions for the whole region, not just solutions everyone for own country. That's one of the biggest problem, and that's why I think that we should turn towards regional approach and also Euro-Atlantic integration, because always united is stronger, even especially in this kind of crisis and pandemic.
Thank you. So in the end, I would also like to ask you about your final thoughts on the new normal, as we can hear this phrase a lot during these months. So is COVID definitely here to stay, and how do we adapt to this new normality?
So, firstly, we have to see which is the reality and to understand it, but to see also the fact that new opportunities are coming. This is how it is also the approach of the European Union. Let's see the opportunities, let's see how a lot of people maybe can work from home. This is more sustainable also for the environment, because after COVID-19, the second biggest problem at world level is climate change, which is happening and which we are seeing. And also the lessons that we learn, because a lot of lessons have come. Each country, and of course, because we are also in the European Union, to have a really prepared team for crisis times. Because now, as I was saying, now we have this crisis, but every time there is a crisis which exists and should be more invested in forming leaders. Because sometimes in many institutions and in many fields, they are reaching people maybe because they have some knowledge or because this political situation can make this to be happening. What is important, if we really have leaders, yes, if they were even the best leaders, they could not solve until tomorrow the coronavirus problem, but could come with solutions on long term, could have the trust of the population, and everything, yes, can go in the good direction if we do this, and if we really understand what democracy means, and all the actors to come together to the same table, to say like this, and to point their aspects, their perspectives, and like this can reach the real solution. Because as I was telling, even the public authorities, if they were speaking from the first moment, but nobody expected, and we can understand them, with specialists in the field to understand the effects of this coronavirus, I think more long-term measures will be taken. Because what I want to underline again, the fact you are a Balkanic country, and so we are in European, but we are very close to the Balkans, very friends, and we have a lot of. I've been to Macedonia, and I know that we have a lot of values in common. We have a lot of traditions in common, and from our culture the same. We have many aspects which we have very similar, so we feel the same. But what I want to tell also for the citizens that maybe are watching us, the fact that in all the countries happen the same. There are some opinion currency which in each country said to us is the worst. This is how, unfortunately, at a certain moment, some channels of information promoted this. In all the countries, it was similar situation and brought the same effect. And what is important is to learn the lesson that we received and to take care of our health, because we saw the persons which were ill, they passed better this time and they healed better. So this is one of the lessons, and also with the leaders to do our best when we vote for somebody to be in the position to represent us and to trust that person, because this is why we put there, to have the responsibility for all of us and for all the community, and this is how democracy can be put in practice. And as I was telling also, the role of the civil society, it is very well understood at the European level, because the EuroDEMOS Association is also part of from the Agora of the European Parliament, and all the time we bring solutions from the territory and problems. This is how we should be much more also at the national level, because it's a trustful partner which can help the authorities in the community to be more close to the citizens. So I wish everybody to be healthy, to pass all this time of this situation that affects all of us, but to do the best to respect the measures are taken, and after it will pass, to see like, look, history was written during our generation.
Thank you, Catalina. And now, Bojan.
Thank Okay, I will point out 5 things. First is the honest communication and two-way communication, especially that public institutions are going to have with the media and the citizen. That's the first thing. Second thing is solidarity. It's also important in the communication process because we have to stress and point out all the time that this is a health problem, which is not problem of a health situation of one nation, another, or some race or ethnical community, etc., etc. And that leads me towards need of tackling xenophobia. I would stress that again because in my communication experience, I would like to stress that I can see or feel some efforts or some examples of raising xenophobia, raising discrimination, hate speech, which should be prevented. And the best way of early prevention is with or through the communication process, especially with concrete measures from the authorities in public institutions. Also, the obvious aspect anymore, that's the fighting or tackling the fake news, which is, I think that we are on the best way to understand how important it is, because if 6 months ago we discussed this topic as this is very important, but still some people thought that maybe it's more a problem of freedom of speech, or that someone wants to change it. Now we can be sure that if we let disinformation and fake news take the stage, it will be a huge problem, especially when we're talking about the health. Actually, Catalina at the beginning mentioned situation in the markets, buying products in panic, etc., etc. So that's the smallest but really huge problem when we let disinformation take the stage. And at the end, digitalization, that's the fifth thing, which is really important, and it's connected with the communication in all aspects. Why? Because we should understand that also the debates that we had until 6 months ago, like is the digitalization a positive process, or the digitalization is some kind of conspiracy theory, etc., that we lost time. Because digitalization is a reality. This happening here is digitalization. Using our smartphones is digitalization. Ordering food, pizza, something from the grocery store is digitalization. Buying online tickets, buying tickets for flights or for another travels, it's also digitalization. And that's why in the communication, especially of the public authorities, but all other stakeholders, we have to emphasize this as very important, because it's important, and we have to point out that digitalization is a process which will give benefits for the citizens. Because in the times of pandemic, in times of crisis, in times when we had to, or maybe we will have to, I don't know what will happen with the virus, we had to stay at home. Digitalization and internet access was definitely as one of the biggest advantages, as one of the most important human rights in 21st century. So I think that we should pay a lot of attention to this aspect, of course, together with the other four, and to have the regional and the integration approach. If we do that, if we are united, and based on the science, based on the interest of the citizens, then we will really have huge results, and the end of this pandemic will come sooner, because as even World Health Organization mentioned in several times, infodemics is really huge problem for the health authorities in the world, but also in the countries themselves. Itself is a huge problem for solving the COVID-19 virus. Thank you.
Well, thank you, Gwen. I think that with this we can conclude our webinar for today. I think that we definitely raised interesting aspects, and we have set up grounds for further additional discussions around how the infodemic can be dealt with. So I would like to thank you again for being a part of this webinar, and also I would like to thank Public Min for organizing it. So hopefully we can discuss again soon with some results and new aspects of the fight against the pandemics. Thanks again.